Hey Sleep Warriors, welcome to our monthly Q&A session where I answer questions directly from you. Let's get started. First question from Terri. Since a sleep study, years after being diagnosed with OSA, my CPAP pressure has been increased from 7 to 12 and a full face mask was recommended. Prior, it was just a nasal. I never used to have any trouble sleeping with the nasal mask. Now I've suffered long nights with leaking masks, and I've tried different full face masks, chin straps, liners, and collars to help with this problem. Help! I dread going to sleep at night, and I end up adjusting my mask all night and wake up exhausted. Any suggestions? Well, Terri, this is a difficult problem, and because your pressure was increased from 7 to 12, I'm guessing that you needed a higher setting in order to treat all of your sleep apnea. And this higher pressure may then be blowing your mouth open, which is causing some mouth leaks, and that may be why your provider recommended using a full face mask. So in order to get your mouth closed, and then it may be worthwhile to decrease your pressure back down. This can sometimes be done with an auto-titrating CPAP instead of a fixed CPAP pressure. Additionally, you can try talking to your provider about if your sleep apnea might improve if you try to, say, stay off your back, or other behavioral things that you could do that might help a lower CPAP setting be effective for you. There are also new masks coming out all of the time, so you may want to try a different new full face mask, such as the F40. There's a new AirFit F40, which is a little bit more flexible and may tend to leak less if you require a full face mask. And then I would also recommend trying going back and using your old nasal mask with your new pressure setting and see if that with just like a chin strap or the Somnoseal or something might help to keep your mouth closed and keep you more comfortable. Good luck. Tina asks, do people ever outgrow the need for a CPAP machine? Well, sleep apnea does not tend to get better with age. In fact, it tends to get worse with age. That being said, there are a few behavioral things that you can do to decrease the severity or potentially even get rid of your sleep apnea. The number one thing that you can do is weight loss if you're overweight. So losing even a modest amount of weight can really decrease the severity of your sleep apnea. And even if it doesn't get rid of sleep apnea completely, you might be able to decrease the pressure settings on your CPAP, which would make using your CPAP more comfortable in general. So other things that you can do are strengthening the muscles on your airway, and that would be things like myofunctional exercises or learn to play the didgeridoo. Things like that can improve the strength to keep your airway from collapsing so much at night and improve the severity of your sleep apnea. Lastly, you can try sleeping on your side or in different positions that may decrease the severity of your sleep apnea. And while this is not typically a standalone treatment, it can also help to decrease potentially the amount of pressure that's required, making CPAP more comfortable for you. I hope that was helpful. Badgernath asks, I've been using CPAP for the past 2 years, but I'm still feeling tired and non-refreshed the whole day, and due to this reason, I'm unable to control excess daytime sleeping. So, Badgernath, it's not uncommon for people to continue to feel tired even after they adjust to using their CPAP machine. And this can be for a variety of reasons. You want to make sure that, number one, you're getting enough hours of sleep. So sleep deprivation is rampant in our society and probably the number one reason why most of us are tired. Number two, you want to make sure that the sleep that you're getting is good quality sleep. And you're already doing that by using your CPAP. Now, what you can do is make sure that the CPAP is working effectively, and that would require a visit with your medical equipment company or your provider to make sure that your residual AHI number is low, and thus your machine is working and doing its job to fully treat your sleep apnea. Now, if both of those things are going on and you're getting enough hours of sleep and you're using your machine during your entire sleep time and you're still feeling sleepy, then there may be something else going on. One of those could be like medications that you're taking. It could be stress, and other environmental circumstances can sometimes lead to being fatigued or tired. There's also some changes that occur in the brain from having sleep apnea that just don't reverse completely, and sometimes people continue to feel tired even after doing everything else correctly. You might talk to your sleep medicine provider about this because there are some medications that are approved to help with wakefulness in this situation. Other behavioral things would be making sure that you're exposing yourself to daylight, that you're getting some exercise, and you're not overdoing it with substances like caffeine or alcohol. Thanks for your question. Mary asks, I don't want to use a CPAP machine. What else is there that Medicare will cover? So Medicare covers CPAP first and foremost as the gold standard treatment for sleep apnea. That being said, if you have more mild to moderate sleep apnea and you want to consider alternative treatments, for example, an oral appliance device, so this would be something like this that moves your lower jaw forward to help open up the back of your airway to treat your sleep apnea. So Medicare will contribute towards an oral appliance. However, it tends to be significantly lower than the cost of the oral appliance along with the dental visits to get it made and adjusted properly. So there is a greater out-of-pocket expense, usually around $1,000 or so, in order to get the oral appliance, but it is something that Medicare will contribute towards. There are also some surgical solutions if you qualify. That may be some airway surgeries or nasal surgeries, or the Inspire device, which is the implantable nerve stimulator that helps to pull your tongue down to open up your airway during sleep apnea events at night. So for the right candidates, Medicare can cover those options, but again, CPAP is the tried and true gold standard that Medicare tends to pay for first, as well as it being the quickest way to a solution for treating your sleep apnea and feeling better. Thanks for your question. Beryl asks, I cannot tolerate anything on my face. How do I wear a CPAP? Well, most CPAP masks, the way that they work is by blowing air, a forced stream of air, just like blowing into a balloon, in through your nose or your nose and mouth to keep your airway open. So it needs to create a seal in order to get that pressurized air where it needs to go, which is in the back of your throat. So if you cannot tolerate anything on your face, then CPAP may not be a great option for you, and you might want to consider something like an oral appliance that goes inside your mouth. If you want to use the CPAP but just don't tolerate a lot of the masks on your face, you could try some of the other styles of masks. There's one called the Bleep mask, that's BLEEP. You can look at their website. They sell masks that don't have any straps. They just attach to your nose and don't have to go over your head. And so some people that don't tolerate other masks may do better with the Bleep mask. So give that a try. Thanks for your question. Diego asks, I did sleep studies in the lab and at home to make sure that I have sleep apnea. Is there any other way to detect this condition? Good question, Diego. The home or in-lab sleep study is the gold standard way to diagnose sleep apnea and is generally required by most insurance companies in order to pay for treatment of that sleep apnea. Now, that being said, there are some new things, some things that came out just this year that can help screen if you are at high risk or not for sleep apnea. And those would be some of the software that is included with an Apple Watch or a Samsung Galaxy Watch. And that can tell you if you're at sort of high, medium, or low risk for sleep apnea. That being said, if you are at low risk and you have symptoms, it's not a perfect test, so that doesn't mean that you don't have sleep apnea, but these new software systems on the watches, etc., are ways that the general population might be more alerted to their risk for sleep apnea. And this is because these watches and things can detect oxygen levels during sleep and can then flag it if you are having a lot of drops in your oxygenation. So other things that can give you an idea that you may have sleep apnea would be just witnessed apneas during sleep. So a lot of people that snore, their bed partners will report that they have pauses in their breathing at night. And these pauses, and maybe they snore, pause, followed by a snort. And that can be a very good sign that there is likely some sleep apnea going on. So other than these things, there are new devices out like rings or different patches and things that are detecting low oxygen levels during the night, but they aren't quite ready for prime time. So stay tuned. Thanks for your question. Thanks for being here for this week's Q&A. I will see you next month.